Hi, I'm Dr. Miles Ashley,
And I'm Dr. Sam Ashley.
and we're optometrists at the Vision Clinic in Vicksburg, Mississippi. And we're going to start doing some informational videos on eye health topics per request from some of our patients. The first topic today that we're going to talk about is contact lens complications related to sleeping in the contacts. And I'm going to let Dr. Sam Ashley take over from here on that.
Okay, first of all, as far as wearing contact lenses, we don't really suggest as far as any type of extended wear or sleeping in the contacts overnight. The complications or risk of doing that, secondary to not getting enough oxygen to your corneas, would be increased risk of eye infections by anywhere from 5 to 10 times as much as wearing the lenses strictly as a daily wear basis. Some of the things as far as complications that can happen would be anywhere from like an acute red eye, to where the cornea started getting inflamed, you started developing a red eye, secondary to overnight wear, anywhere from a dirty lens. Actually, you can start developing something called neovascularization, where blood vessels can actually grow down into the cornea. This is somebody that has done it for a long time and has abused their contact lenses on a long-term wear basis. You can get secondary corneal scarring. You can get something called giant papillary conjunctivitis, which is just little bumps that develop up under the eyelids, and that's secondary, like an allergic type reaction, secondary to a frictional type movement where the contact lens, your eye blinks over top of the contact lens, and the lens may be dirty or just a frictional type thing. You can develop this type situation here. And that can go anywhere from that type of reaction to an acute red eye. An acute red eye. Here's an eye, that developed redness secondary to having the lens on, and the cornea has got some swelling. It's something called CLAR or contact lens acute red eye. All the way to start to develop a bacterial corneal ulcer, which is the most serious thing that could happen. This right here, this is an eye that started with a little small abrasion. They thought it was a scratch on the cornea, and that little spot started developing a bacterial infection where it started getting larger and larger to where the cornea is getting cloudy here. This is something that could actually go from a small ulcer into a very serious perforating corneal ulcer, where the whole cornea can get cloudy, and you could actually get to have serious loss of vision. Like I said, this will be a case, worst case scenario, to where this particular person may have had to have a serious eye surgery, such as a corneal transplant, to get vision back in this eye. So, as far as that's some of the things that can actually happen, too. And there's certain things that we can do to help prevent it and some of the symptoms. I'm going to let Dr. Miles actually take back over as far as, some of the things as far as what to do in case you start developing a red eye like this.
So if you think you are starting to develop an ulcer, which would be symptoms of redness, pain, light sensitivity, or cloudy vision, the best thing to do is to take the contact lenses off and go see your eye doctor. Chances are, they'll end up putting you on antibiotic drops probably every hour or more frequently for several days. From there you may have to stay out of the contact lenses for a period of time. But the best thing to do is just to not wear the contact lenses overnight, to not get yourself into that situation. So we're going to continue doing these monthly videos here, and if any of you all have any suggestions on topics that you'd like us to discuss, please leave some feedback on it on Facebook, and we'd be glad to address those.